Welcome back to the Transplant Medications video. Valcyte is an antiviral medication. Valcyte is the brand name for valganciclovir. It can prevent certain herpes viruses, such as cytomegalovirus, called CMV for short, which either you or your donor or both may have been exposed to before transplant. Most adults have been exposed to CMV in their life, but may have lived quietly in the body without causing symptoms of infection. Once you start taking anti-rejection medications, CMV may be able to reactivate, which means that it can start to cause an infection. Valganciclovir is used to prevent CMV from reactivating after transplant. It does not protect against all viruses, such as the flu or other common cold viruses, so it is best to stay away from sick friends and family if possible, and to wash your hands frequently, especially during the flu season. Most people do not have any noticeable side effects to valganciclovir. Valganciclovir comes as a 450 mg tablet or as a liquid. The usual dose of this medicine to prevent CMV is 1 or 2 tablets once a day. The transplant pharmacist will tell you what your dose is before you leave the hospital. The tablets should not be crushed. If you are having trouble swallowing the tablets, please let your transplant team know so that we can get you the liquid form instead. This medicine will only be used for a short period of time after transplant, typically for 1 to 12 months. You are at the highest risk for developing CMV in the first few months after transplant because you are on high doses of anti-rejection medicines. Your transplant team will tell you how long you will need to take this medicine. After valganciclovir has been stopped, we may periodically do lab work to check for the virus in your blood. For females of childbearing potential, valganciclovir may have the potential to cause birth defects in humans. It is recommended for women to use effective birth control when taking this medication, and for at least 30 days after stopping it. For males, valganciclovir may have the potential to cause birth defects in humans. It is recommended that males use barrier contraception, such as condoms, when taking this medication, and for at least 90 days after stopping it. This concludes the Valcyte video.